and welcome to A Dose of Wellbeing, the Pharmacist Support podcast. I'm your host, Melissa Cochran, Wellbeing Development Manager at Pharmacist Support, the profession's independent charity. We're delighted to bring you inspiring stories, tips, and expert insights that can help enhance your well-being and make a positive impact in your professional life. This podcast is all about supporting you, our pharmacy family, as you navigate the challenges of the profession. Today, we're speaking with Mark Sweeney, a pharmacist and one of our trustees. Mark is an experienced pharmacist and independent prescriber, and he has a special interest in the treatment of addiction, anxiety, and depression. He's currently a PhD student in the Department of Brain Sciences at Imperial College London, studying how psychedelics can be used as potential treatments for addictions. Mark is passionate about evidence-based drug policies and improving the lives of people facing difficulties with substance use. He is working on the cutting edge of new approaches to helping people living with addiction, and we hope you enjoy today's fascinating conversation. So Mark, welcome. Thank you for coming on the podcast today.
Thank you for having me.
I'd love to know how you first got involved with psychedelic research.
Absolutely. So my background was very much in addiction. So working clinically as a hospital pharmacist, I cover plenty of wards where you'd see people coming in with substance use disorders, and you'd see people coming in with repeated admissions. And there was a lot that we could do to help the short-term complications of drug use, but there's very limited that we can do to help long-term change. So as part of discovering what I was interested in and how I wanted my career to develop, I was looking into new treatments for addiction. And one field which seemed to offer some real innovation was the use of psychedelics. And initially, it seemed strange because I thought, these are drugs which are highly controlled. They're Schedule 1 CDs. How could these be beneficial in treating addiction? Could you treat could you treat drug dependence by using a drug? But when looking into it, there's a body of evidence that shows that psychedelics can be beneficial for difficult to treat mental health conditions, including addiction.
So this is a relatively new and emerging area of research, and I'm not sure how well understood it is by the general population. What would you like pharmacists to know about the medical uses of psychedelics?
Absolutely. So psychedelics are a powerful class of drugs which produce an altered state of consciousness for a short period of between sort of half an hour to 6 to 8 hours. Now, psychedelics are drugs like psilocybin, which is the active ingredient in magic mushrooms, LSD, or DMT, which is the active ingredient in ayahuasca, which is a naturalistic brew which is used in some naturalistic settings. Now, all of these drugs are Schedule 1 controlled drugs, which means they can't be prescribed or used outside of a clinical trial in the UK. And there are clinical trials ongoing which are investigating psychedelics for difficult to treat mental health conditions. And these are a fundamentally different treatment modality to what we have with existing medications. So psychedelics are often given either once or twice, and they have a long-lasting effect. Mm-hmm. So they're not like regular antidepressants or other medications which are used for mental health conditions, which are often taken once a day. These drugs are administered once in a controlled environment with supportive therapy or psychological support before, during, and after the experience. So it's a fundamentally different paradigm to other treatments which pharmacists might be used to dispensing or prescribing. Psychedelics are a powerful new class of drugs which are showing promise in treating hard to treat mental health conditions.
Amazing. Good to know. And since you've started working with psychedelics, what's been your most unexpected finding?
So for me, I think the first real unexpected finding is that these drugs have medicinal value. And the definition under the Misuse of Drugs Act is that Schedule 1 drugs don't have medicinal value, but the research shows that these drugs are showing promise in treatment-resistant depression, in addictions, and in a number of difficult-to-treat mental health conditions. So that was the first surprise, really, when I was looking into the field, is I thought that these were dangerous but addictive drugs, and this is why they're so heavily controlled. But that's very much not the case. Far more harm is caused by drugs like alcohol, by opioids, and by tobacco. And these are drugs which are all in lower schedules and are either prescribable or available for purchase.
Wow. And so how do psychedelics compare to traditional treatments for mental health conditions such as SSRIs or therapy?
So a fundamental difference in how psychedelics seem to work is they work on the mind as opposed to on the brain. So they change the way that the mind works. So when someone takes a psychedelic, they have a profound experience which is well documented. And what we see when we look at brain scans is there is a relaxation in the control area of the brain, the default mode network. And this is the part of the brain which is responsible for your self-referential thoughts, how you see yourself in the world, and very much how you see yourself in your community. So it's responsible for some of those behaviors and those thought patterns which are active at rest. And under a psychedelic, that control network is relaxed, and areas of the brain which wouldn't normally be connecting or communicating together do. And in that period, and in the period immediately after, there is a window of plasticity where people can learn new behaviors. They can have new insights. And in the immediate period after their psychedelic experience, the therapists who sit with them on the trial help make sense of those, help make sense of the new insights that they have and integrate it into their lives going forward. And that seems to be how meaningful change happens.
Yeah, that's fascinating. And I've done some extra professional development on trauma. And one of the things that they say in brains of trauma survivors is that they tend to be, certain areas of the brain become disconnected from one another. And that's part of why they get stuck in the trauma response. And so a lot of trauma treatments are trying to connect up these areas of the brain. So it just gets me thinking, I would imagine there could be applications in the treatment of trauma as well.
Yeah, absolutely. And this is another area where there is investigation, because PTSD there is a real unmet need in the treatment of PTSD and other trauma disorders. And psychedelics are showing promise as a potential tool to treat them.
Very interesting. Okay. So how do you find that other pharmacists respond to you working with psychedelics? What do they think of your work in this area?
With intrigue. So it's not a usual run-of-the-mill job. There's two parts to it, I guess. I guess there's a part working in research and there's a part working with psychedelics. And there's a lot of misinformation and there's a lot of hype around psychedelics. So a lot of people are very, very curious and they want to hear more about the research and try and relate some of the things that they might have read online or heard about from other people to how this relates to my role and what I'm doing. So people on the whole are really curious, and when they hear about some of the work that we're doing and some of the conditions which these psychedelics are being applied to, there is a real understanding that these treatments provide a massive amount of hope. They can have an impact in real areas of unmet medical need, which as pharmacists we see very frequently, particularly in the work that I'm doing around addiction. as pharmacists, we see people who are struggling with addiction, who are living with addiction, and the ability to provide a treatment which could potentially be life-changing is something which I'm really curious about.
So it sounds like people are mostly fascinated, interested, supportive.
Yeah.
Yeah.
On the whole, people are very, very supportive because these treatments provide promise. And as pharmacists, I think we're used to being patient-facing, and we see some of the areas of unmet need. So people are supportive, and people are really curious about some of the research that's going on.
I think that's wonderful. And what are some of the benefits and risks to taking part in a trial that involves psychedelics?
So the real benefit is being able to take part in research which is investigating novel compounds which are showing real promise. And from the research that we've seen in other studies, the effect that psychedelics have seem to be really beneficial. They seem to be more effective than any other treatment for certain conditions. So the main benefit is being able to potentially access these trials of these drugs. The main risk is during the psychedelic experience, people can revisit repressed memories or have difficult experiences. And while that can sound scary, research has shown that often people who have the most difficult experiences actually have the best long-term outcomes. But that is a risk. People could have a difficult or challenging experience. But I think the biggest risk to this research is the research not being done. Because every year, millions of lives are affected by difficult to treat mental health conditions like addiction, like depression, and plenty of lives are lost to it. And if we don't investigate these drugs which are showing promise, we risk missing a window of being able to try and help and make a real impact for people who are living with these conditions.
Wow, that's really, really powerful. I can see how we really need some new treatments for a lot of these, what seem like more intractable mental health conditions. You've mentioned a few conditions that it looks like psychedelics are helpful in terms of treatment. Are there any other conditions that it's being looked into for?
Yeah, there seems to be a trial for every condition under the sun at sometimes.
Okay.
But the main body of evidence from sort of the modern times of psychedelic research is been in treatment-resistant depression. So at Imperial, the largest trials to date have been in investigating psilocybin, which is the active ingredient in magic mushrooms, as a treatment for TRD. That being said, smaller trials are being done at the centre, looking at anorexia, looking at fibromyalgia and chronic pain, and looking at OCD. And these are all conditions which, again, are really difficult to treat and have an underlying commonality in that they are characterized by repetitive, ruminative, negative thoughts about oneself.
Yeah. That's so interesting. Do you think there are any medical conditions that would exclude someone from being a good candidate for a trial?
So one of the difficulties with research is the sample of people who go into clinical trials needs to be quite homogeneous, which is different from clinical practice. So at the moment, some trials have a long list of exclusion criteria. One of the main exclusion criteria is a history of psychosis or an immediate family history of psychosis, because that could predispose someone to a difficult experience. That being said, that is one of the main exclusion criteria. Then another area of research and something which I'm working on is trying to understand how psychedelics interact with other commonly prescribed medications, because with a lot of these conditions, people are prescribed other medications, and we need to understand some of the interactions, how we can manage them in the period where someone might be taking part in a trial or having a psychedelic experience when these are prescribable treatments. So that's an area which needs more research, is understanding how we can manage prescribing of psychedelics when they come to the clinic.
Mm-hmm. Yeah, that's really interesting. And are there any upcoming areas of research that you're excited about? Is there anything on the horizon?
Absolutely. So one area which I'm really excited about is the use of psychedelics to treat addiction. So the project which I'm working on for my PhD is trying to understand the efficacy, the feasibility and the tolerability of psilocybin therapy for opioid use disorder. So to see if psilocybin therapy could be useful for people who've stopped using opioids, both illicit, so drugs like street heroin, but also opioid substitution therapy, so drugs like methadone and buprenorphine. And this research builds on work that was done in the 1970s using a different psychedelic, where 78 people from Maryland who were opioid dependent on heroin were split into two groups. One was given a placebo and the other one was given a psychedelic. And they were followed up. And at the end of the trial, 5% of people in the placebo group were still abstinent. So 95% of people had relapsed.
Wow.
Whereas in the psychedelic group, 30% of people were still abstinent. So this is a real sizable change on treatments as usual. Psychedelics are really exciting because they could be one of the treatments not only to manage addiction, but to help resolve it or to potentially cure it.
That is really exciting and very, very much needed, because it is, we do know that relapse rates are, they can be stubbornly high, and it's very difficult for both the people who are trying to resolve addiction, but also their families and people around them. So there can be quite a cost to that.
Absolutely. And everybody will know, either personally or professionally, somebody whose life has been affected by addiction to drugs or to alcohol. And the fact that these treatments are being investigated and are showing promise is really exciting and provides a lot of hope. Okay.
So on that note of hope, what do you think the future holds for psychedelics in pharmacy? Do you think we can expect to see them coming to a pharmacy near us in the future?
So that's a really interesting question. I don't think we'll see them in community pharmacies anytime soon. But what I do think we'll see is a increase in public interest. And as pharmacists, we are bound to have patients asking us, what do we think about them? Do they work? Is what I've read online about them true? So I think that there is a real imperative that pharmacists are able to have evidence-based and rational discussions about some of these drugs. We might see them as they move towards the clinic being trialed in... we might see them as they're moving towards the clinic being used in hospitals or tertiary centres. So pharmacists probably will be coming across them. But the main thing, I think, is being able to have that discussion with people who are interested and who would like to know answers from reputable sources, which is what pharmacists are.
Absolutely. Yeah. Very important sort of sources of knowledge in the community. And if someone were interested in learning more about the role of psychedelics in mental health, where would you advise them to go?
So there's plenty of places where you can find information about psychedelics. One really good resource is on the government website, on the Parliamentary Office for Science and Technology. They've commissioned reviews of psychedelics to treat several different health conditions, and they have dossiers on each one. So they have a document on psychedelics to treat addiction, psychedelics to treat eating disorders, psychedelics to treat treatment-resistant depression. So they're really good, impartial guides on to find more information about psychedelics. Also, the Drug Science website has lots of information about how psychedelics work and some of the trials that have been done. And finally, the Centre for Psychedelic Research at Imperial have a website which has lots of information about our ongoing and upcoming studies.
That's wonderful. Before we wrap up, is there anything else that you would like people to know about your work, psychedelics in general, the future of treating mental illness?
I would say that there is really exciting research being done. And this is perhaps one of the most exciting times in research, particularly around addiction, but in mental health conditions. And some of the results that we've seen from clinical trials have been really promising. And it's going to be an exciting transition as these trials are replicated in larger real-world groups. And hopefully we'll be able to see these treatments providing genuine options and genuine hope for people in the community.
That's wonderful. Well, this has been such an interesting conversation about new developments using psychedelics in the treatment of substance use disorders. Thank you, Mark, for sharing your insights and for being a part of the Pharmacist Support podcast. I'm sure this will inspire people to learn more about the fascinating research going on in this area.
Thank you.
So we always hope our listeners are feeling inspired to bring about positive changes in their own lives. If today's podcast has resonated with you, you'll find more well-being information, videos, and online content in our website and on our well-being learning platform, which is available to pharmacists, pharmacy students, and trainees for free. For further information on our support services, please click on the How We Can Help link in the podcast description. Please don't hesitate to reach out if you feel you may need support. We want to continue to provide our free and confidential support services and to open up conversations like this in order to ensure that no one in our pharmacy family faces challenging times alone. As an independent charity, we rely on donations from individuals and organizations across the profession to enable us to do this. If you're in a position to do so, please consider making a donation today. You can find a QR code in the show's description at the end of the video. Donations help us to provide our essential services, including our counseling and peer support, financial assistance, and more. Thank you so much for listening, and we look forward to seeing you again on our next podcast.